Very excited to speak with our guest today. So I'd like to welcome Dr. Pai. Sorry, let me just change slides here. Dr. Pai to our webcast today. So thank you so much for generating your time to help inspire our youth and people that are tuning in. So I won't read out Dr. Pai's biography here. I will just let her do it. So welcome.
Hello.
So let's start with you, Nitika.
Yep.
I think it's very important for us to have role models to inspire youth so that we can see heroes that look like us, come from similar backgrounds or narratives to show that breaking a certain ceiling is possible. Oh, wow, that person achieved it. How do we get here? So I think, can you walk us through your journey of becoming a tenured prof in medicine at McGill and then getting into your AI work? So welcome aboard.
Thank you. Well, good morning, everyone. Hope you're having a good time and are all ready to listen to us. My journey, I totally agree with you that we need to look at people who walk like us, talk like us, and have a reasonable, can show that they have achieved reasonable level of success so that people can follow in their footsteps and exceed them. And this is exactly the path that I've been doing for the past few years at McGill with my students and trainees. I come from India. I'm a very proud Indian. I wouldn't have immigrated to North America were it not my husband who wanted to study at Berkeley. And so I was training in surgery. I and one of the conditions of my marriage was that I'm an ambitious Indian woman, so I will not marry unless and until you agree to supporting my career. Otherwise, you know what? Fair enough. Find somebody else. Poor guy, he waited for me for 5 years, and for that I'm extremely grateful. And ours is a two-state story. So I'm from North India, and my husband is from South India. So if people from South Asia are in the room, they probably know how difficult it is to unite North and South in India. So it was pretty difficult personally to have these two in one room. Two as in two states and two regions in one room. But thankfully, I think destiny happened. And even though I was dead serious about, and I was in a training program in general surgery, and dead serious about continuing on that track, I kind of reflected on what I really wanted to do, big picture. At some point, I have this. I tune into my intuition, and that's what I would recommend everybody to tune in. Sometimes, to life's complex questions, you probably tune into your intuition because you do not have the answers and you cannot get the answers. So I tuned into my intuition and I said, I've always wanted to work in the big picture of global health and public health. But in India, the way public health and global health was being, not global health does not exist, but public health that was being presented in medical schools and programs, residency programs, was so anemic that it never inspired people to take that track. And so when I was thinking about moving out of India, I thought, okay, I will try to explore this track, but keeping my clinical part alive. So I followed with my husband, which I would have never done in a million years because I'm not a follower. I'm a leader. But I did because he's a nice man. And so we followed, and I'm being very transparent here, probably not being politically correct. Followed at Berkeley, and Berkeley really transformed me because I saw and met a lot of professors who had transitioned from a clinical track to a public health track, and I literally interviewed them, and they were very nice to me. And then I decided to just try out an MPH program at Berkeley. Thankfully, I was lucky enough to be applied to all these programs, got into Harvard many times, and my daughter says you have this tag on your shoulder of getting into Harvard but not getting into the program, but like not joining the program. So did that, and then I realized that I was actually a scholar, and I enjoyed clinical work, but my real calling lay in doing something big picture. And that's when this whole idea of PhD happened, which was never in my track. So when I called my mom from India and and I told her I'm going to do a PhD, her answer was why. Like, why? Who after an MD does a PhD? Well, my mama, and she's an educationist, and so she always has the knack of hitting the nail on the head. Anyway, so that being said, after a PhD, It led to a fellowship, and that was the time when I saw US academia at very close quarters. And I realized, and I told my husband that I don't think we'll be able to really think beyond our careers because we're two crazy people who love our work. And it was me who actually said, you know what, we should probably shift to Canada. And it took us a long time to make the decision to actually give up our Indian citizenship. And so we moved to Canada, and thankfully, I was able to apply to the. I'm making it sound very easy. It is not. Every step has roadblocks and obstacles. But it's cut the long story short. I applied for the CIHR HIV clinical trials program because I work in HIV. So I transitioned to infectious diseases, and I did a lot of clinical work at UCSF under Dr. Jackie Telsky, and also picked up this degree in epidemiology because it was big picture. I enjoyed it, and also learned statistics. And Berkeley was the place that just transformed me. And after that, did this fellowship in infectious diseases when I moved to Canada. And then I just it had sunk into me that I was actually an academic in denial, and I needed to join academia. And so so thankfully, everything worked out. But it wasn't easy to getting a job wasn't easy for me because my husband was got into the tenure track position, and he's 4 years professionally, 5 years professionally senior to me. So it's always a tough thing cutting into the glass ceiling, and it's always difficult for women. And so I often wondered, why is it that the jobs are not coming to me? I also do that. And then I realized that there was something called a ceiling that I had to break. And because I've always been an athlete and a sportswoman, I love challenges. So I said, okay, if this is a challenge, I will take it on. So I was told that as a woman, you're always lowballed in academia. You are not given your due. And I never did I realize that I was a different woman, but it kind of dawned on me when my daughter was getting bullied at a private school in Montreal. I realized that perhaps this is also happening to me in different shades. But at that time, I was too focused on my work. And so that being said, I applied to many programs and many universities, and thankfully, I had publications and all of that. So I had built up my CV in such a way that I had all those credentials. And also in parallel, I built up an independent research program on diagnostics because that just fascinated me. I had to do a clinical trial. I had to run a clinical trial in Africa, but because of ethical reasons, I opted out of it because at the end of the trial, the patients were going to be denied treatment. Yeah, and I said it's just unethical, and I'm not going to run this trial. So I worked on all the methodology, but I did not end up doing it because it was against my ethics. So I don't know, it's probably sounds stupid, but I did it. And then I transitioned because I could not do treatment related work, because out here the treatment space is very saturated. There are too many people working on treatment. I decided consciously to take a space where there were no takers, and that was diagnostics. So I was told that it was stupid to work in point of care diagnostics in Canada because there's nobody interested in it. And that was the reason where I thought I had that intuition that because nobody's interested in it, that's a nascent field and I'm going to go there. Yeah, and so then I built up that program in based out of Montreal, and had programs and had projects, and then funding came in and all of that happened. And then I discovered innovation, and thankfully Grand Challenges Canada happened, and they were funding innovative solutions, and that's when I found my ikigai, my life's purpose in innovations. And even with that, they told me that this is not going to work. And that is where, when people say it's not going to work, I love it. It just gives me 300% more energy. And that's where I find, just because you guys are saying it's not going to work, it is actually going to work. And so proving that thing that was not going to work became my life's purpose for a while. And that's how it led to, all the things that you need. You need a certain number of publications, you need grants, you need these awards, you need salary awards. I mean, getting a tenure track position. So I took it as an opportunity. I was told I will not get a job by people. And I said, great, that's fantastic. And now I will get a couple of offers to let you know that, how I will get a job. So do not be dissuaded when people tell you that you won't get a job in Canada. Please interview far and wide. And I did interview. It wasn't easy, But I took that as an opportunity to explore Canada, to explore institutions, to explore networks. And I said, at the end of the day, I really want to stay in Montreal. But if this is a game, I will play it. And I played the game, and I couldn't believe it when I got the job that I really wanted at McGill. And then I did whatever was needed, like I was told, don't try and get more grants, don't apply for these new investigator awards, take your time, don't be in a rush. Don't more work more here, work more there. And I was like, I'm in a rush. I don't want to wait for anyone. I'm going to do what my gut tells me to do. So I did not listen to people. And, maybe my story is one of a rebel because I've always been one. I don't know. It just worked out for me. I think when people say don't do something, there's always a vested interest. So always listen to your heart and don't give up on your dreams. I guess that's the summary of the story. And then, when I had the requisite number of papers, because they only give you 5 years to get tenure, it was a very tough time. I was also a new mom. I had to raise a child too, and of course my husband was always there for me. But like getting all the support to be able to dedicate to your career is very important, especially for people like us who do not have familial support. And I don't know, it was destiny and support. So I hope I haven't taken a lot of your time in asking this simple question, but a complicated answer to the simple question. And yes,
No,
it was a
I think
relief.
all of us listening here are really lucky to have heard that story. There's so much. I just want to kind of rewind a bit and have you. Wanted you to finish the journey in the story because it's so important to hear that and inspire others. First of all, I think your husband's been like the secret other guest in the show right now. What does your husband do? I feel like we need to figure out.
He's the inaugural chair of the School of Public Health. So he's also a professor of epidemiology and global health. So we're on the same track. But he was the original epidemiologist in the house. I was the one who just kind of meandered. I
Okay,
am
okay.
still in the clinical frame of mind. So yeah.
Well, we're all very happy that you're on our team, Team Canada, and you guys chose from Berkeley, California, to come to lovely Montreal. Yeah, no, very. I think we're all great choice to a great city, great
Yeah.
university.
Yeah.
So that's it's really inspiring. Um, you talked about the shift to Canada, and we work with a lot of new immigrants that are trying to make a career shift, that are come here for the Canadian dream, and get here and face a lot of challenges with breaking into the job market, although very qualified. Do you have any? I know we haven't really got to AI yet, but I think it's really important for the people listening. You said you just keep working at the job market, things like that. What advice do you have for those sort of new Canadians that are very well experienced, have engineering degrees, business degrees from universities in India, Africa, etc., that come here and have a hard time getting that recognized?
It's a loaded question. So I can only talk about my space. So the thing is, I think um, it's important to build connections and to attend fairs and to explore forums like yours. And I know that your forum is trying to integrate people, and we need more of these opportunities for people to know what is the secret formula of breaking in, right? And most there is no secret formula, but one of the things that I would suggest and that I've done with my trainees who've come from all parts of the world is they work with me under in any in some kind of a job. Like it could be project management, it could be coordination, it could be you know um, as a student. It could be, if they're good enough, they transition to becoming a student or a trainee. If they're highly trained, then look at so explore these opportunities in your spaces, attend these events, network with people, go out there, and especially to the women in the room. I can't see the participants here, but go out there and be a little bolder and ask. So it took me a long time because I was raised by a very proud father who said people from good families don't ask. So I was like,
They
okay,
just do.
yeah, but okay, so that was the cultural conditioning I had. So it was very hard for me to ask for a raise until I realized that the North American culture is built on asking. And so when I went to the chair of medicine and I had all these awards, I said, look, it's extremely hard for me to ask you this, but you have to listen to me. And I asked for like, okay, just give me $10,000. And then I just left the room. And, and it was so funny that he heard it, he smiled, because first I showed him all the things that I got. And then I told him that my father's raised me to not ask. So it's like a big thing that's going to come out of my mouth. And he was just laughing his head off. But he gave me. So what I'm trying to say is that, you have to get out of your cultural conditioning. And we have all different kinds of cultural conditioning and cultural backgrounds that we come from. And then we have to integrate into a background that is very different from ours. And that is the big one. The other thing is, really selling yourself and being out there and talking about what you do, and being a little shameless, if I may say, like, being a little more bolder. So I used to be bold about everything, but when it came to my work, I thought my CV is over there and my CV speaks for itself and people should hire me. But it doesn't work like that. You can list everything on your CV. What people really want is a face-to-face conversation with you, or a Zoom conversation, and they have their own decision making where they figure out whether you're good for the job or you're not good for the job. And that moment is critical. So not overselling yourself, not underselling yourself, just selling yourself. So those are the tips and tricks that I think we need to share with people.
Yeah.
Yeah, yeah.
Amazing answer. I mean, like one of the things you just mentioned, I think is really important, is our culture conditioning, our cultural conditioning. And I think, especially people that come from, I think, Asian cultures that are more about respect and has this sort of, system of respect. Whereas North America, to your point, we need to be bolder, shameless self-promotion, right? Those things that we kind of look down on or do not think are appropriate from the cultures we come from. But it's kind of what you have to do. Your story about getting your raise and taking all your awards and putting it on the table and be like, I just want $10,000 and leaving. It's a great story. But no, it's very important. And I think that is it. That a lot of immigrants, come here and are very conditioned to not be bold. So, guys listening, I think that's a great nugget. A couple quick questions. You said, when you came, you as a female South Indian, you looked at what are the ceilings that you need to break. Can you just give a quick example of one of them you identified and said, like, this is a ceiling that I want to break?
So in the beginning, it was easy when I just wanted to remain a fellow. The moment I proclaimed out to the universe that I actually want a faculty position, people were shocked, because they thought that I would stay in that position for a while, because that's the norm. Most people are kept in academia. They are kept in these positions, and that is the culture in many universities. And let me be very bold about that. And so that is, and most, if you look at it, and if you do a review of people, most Asians are actually caught up in that vicious cycle. And In fact, I was the one who inspired my husband to get out of Berkeley, if you want to believe me, because I saw potential in him, even though I didn't understand a lot about academia. I didn't even know. So there's a hard money position and there's a soft money position. So I only understand money. I don't know how it becomes hard and soft. The hard money is tenure track and soft money is contract work. So it took me a while to understand the difference between hard and soft money positions. And thankfully, when because he was senior to me and he had finished his education, when he was on the job market, we were being recruited as a couple, and I followed him, and I learned the tricks of the trade by observing what he had to go through. So when it was my turn, I had I knew how to walk the walk and talk the talk, and I knew what they were looking for, but I didn't know how good or how bad I was. Like, you don't know your worth unless and until you put yourself out there on the job market and do a couple of interviews. So please go for these interviews. Please ask for feedback. Please ask for people to, even if they are not, while they are talking to you, just tell them, like, this is what I have, this is what I can do. Focus on the soft skills more than the hard skills. All the hard skills are listed on your CV. They really need to know whether you're a good fit for the organization. So I realized I did have offers in the US. So all those people who said I wouldn't get job offers, I'm a very naughty person also. I would just forward those offers to the people who told me that I didn't get offers. So I had offers from Boston University. I had offers
Oh,
from
wow. Here's what you're
UCSF. I
missing
had
out on.
offers. Yeah, I'm very naughty. I love to irritate people, because it was so bad. When I needed encouragement, nobody gave me. So I'm like, okay, here you go. So, and that the thing was that many female scientists and physician scientists, they don't do that. In fact, I'm mentoring one who's negotiating, and teaching her how to negotiate, and she's at a US university right now, and a South Asian. So the problem
Yes,
is we do
yes.
not negotiate. We are culturally conditioned to not ask, women more so than men, and there's a lot of shame built into asking. And people capitalize on that. So you don't know your worth, you don't know where you stand. So for me, it was important to interview in a couple of universities. I knew fully well at the end of the day that am taking them for a ride, just as they are taking me for a ride. So I said, okay, this is a game, let me play it. And I spoke to a couple of my colleagues who told me not to do, like, not to go for joint positions within departments, not to do this, not to do that, because they were suffering. And so listen to the people who are giving you good advice from a place of good intentions and good heart, because those people are few. They're sharing their life experience. Oftentimes, we disregard that because it's coming to us for free. Advice is a drug in the market. The supply always exceeds the demand. So when they're when they're giving you that advice, please listen. So and I'm one of those who doesn't listen much. Okay, so I'm giving you this advice even if you don't want to listen. But I did listen because they were really sharing their pain. Nikki, don't do this, don't do that, don't sign up. But it helps to have offers. It helps to have this. It helps to have that listed. So then what happened was, even though because my husband was stationed here, they knew that I would not go anywhere. So I said, oh, that's the game now. So then I had to get offers from parallel universities in Montreal, but I had to get written offers. So it wasn't easy for me to get my first job, even though I had all the credentials. I had an MD, I had an MPH, I had a PhD, I had a fellowship. I also had, publications. I had 15 to 20 publications. So I was, yeah, and I thought I was good, like, but you don't know how good you are unless and until you. But the moment I got an offer from Boston, that's when I realized that actually, you know what, they are serious. And I'm not serious, but they are serious. And
Yeah.
they wanted me to lead a $5 billion women's health initiative. And
Just a small project.
just a small project, yeah. And then they told me that I can do long distance. And this is like, I was like, so I asked the lady, because knowing fully well that I'm going to reject the offer, I said, you must be married, right? She said, yes. And your kids, you have kids? She said, yes. How old are your kids? So she said, they are both in university. I said, great. So when they were young, didn't you need your husband to help the kids? Like, did you raise them alone? No, no, no. My husband was there. I said, yeah, that's exactly what it is. I want my child to have her father. I cannot raise a child alone. And that is pathological. That's not good for her development. So, as enticing as this offer is, I'm afraid I'll have to decline. And they hated it because I got up, I thanked them, and I walked away. So I actually, at some point in time, I felt very stupid about myself for my overconfidence, right? Because I had no offer at that time in my hand. But it was just that my gut said, this is not going to work. How can I do long distance? How will I do long distance with a 6-month-old baby? So you have to understand the gestalt. And as women, we think of everything. Women, they say women think of everything. Sorry, I'm talking gender bias here. But, for me, it was important to have my husband, to have my child, to have help, to be able to thrive. So you have to create those conditions for you to thrive. And that's the way some people like it. Some people don't even want to go there. So now that I had these variables in my model, my previous life was supposed to be just by myself, and I would just do whatever I want. But then when I had these variables in my model, human beings that I wanted to nurture, I did not want to do a bad job of it. So this is extremely important to consider, when you're considering dual hiring, single hiring, or moving to different places. You have to consider that it has to work for everybody. It can't be just your solo ambition, to do well in life. And sometimes it works out, sometimes it doesn't. Sometimes it's so all those things are extremely important. And but that is an essential. That was an essential factor for me, because I'm very emotionally grounded and highly spiritual individual. So I need to have all of those things in place before I can, shoot for the stars or for the planets or whatever. Yeah.
Yeah, no. A couple takeaways for me there was that we talked. I think we started with breaking the ceiling, and what I took away from what you just said is that you gained confidence once you started somebody recognize and go, hey, we're going to ask you to come run this big project.
Mhm.
We're going to trust you. That gave you the value that you needed, the credibility. You're like, okay, now I know my value, because this is really about knowing your value, right? And being able to express yourself and be confident in your value, and make sure that you are being valued in your workplace by your bosses, and being confident in the way you approach those things. So that's a really important lesson, I think, is getting to that point. um, I'm going to transition a bit here, but before I do that, you said you're into sports. What is the sport you do play?
I used to be an athlete. I also played basketball and I played badminton, but I was a rabid athlete. Now I don't run at all, but because
I
of
was
getting
not
into medicine.
expecting basketball, but badminton I know is very big in South Asia.
Yeah, yeah.
Yeah, you should try pickleball. That's a good sport to transition into.
I just love running, and I used to be. I actually used to be a national level athlete, if you can believe it.
Oh,
But my
wow.
dad talked me very cautiously. He said, you have something good between your ears, and you might want to consider that.
Consider,
Eh,
yeah, yeah, yeah.
So he talked me out of it.
Fantastic. Well,
But that
okay.
helps me because sports is something, sports teaches you resilience. Sports, which many of, even, I feel my daughter needs to learn a lot of the resilience, because you will get knocked down by life will throw challenges at you, and the purpose of those challenges is to help you discover who you truly are, whether you're going to crumble or you're going to survive. Like, the entire world was thrown a challenge 2 years ago. The pandemic was a big challenge. It taught us so many lessons that we wouldn't have learned, and of course we've forgotten 90% of them. But unless and until life throws challenges at you and you learn to surmount them, you don't really learn much, because successes really don't teach you much. It's the failures that teach you how to thrive, how to survive, how to be resilient, how to spring back, to life. So if
Yeah.
things are not working out, those are the times you actually go deeper and you self reflect as to what is it that is not working out. What is it that I need to do more? Instead of like whipping yourself, you need to do a cautious analysis of your strategy. And that's what I would recommend. And that's one of the reasons why I agreed to do this talk, because I really wish that if my story can inspire people to become the best version of themselves. I haven't gotten there yet, but I know that I'm on my way. But please, I would really like that. I would like that for everybody.
No, no, great. Welcome to our network. I think, we're going to be talking more, and I'm sure we already have ideas. You have ideas of how we can work together in the future. So I agree. Sports are really important. For me, having a sport as a child, I played badminton also. It's just something you can always go back to and have, it's mind body balance, right? And just having a sport in your life, I try to instill that in my kids. So, it's something that they can do later on. But, anyways, let's transition to AI. And
Yep.
thank you again for sharing all of that very inspiring content as part of your journey here. So you mentioned, as a female, the variables in your life, the variables in your model, and I think that's a good transition into AI.
Mhm.
So can you start now explaining like how you got into AI and the work that you're currently doing in AI?
Um, wow. So, for the past 15 to 18 years, I realized when I was working in diagnostics that the real challenge in diagnostics is not just the availability of tools. It was the inability to implement them intelligently within the healthcare systems. And this insight occurred when I was doing field studies, field trials in India, in rural India. And I was lucky to work in a rural hospital that Gandhi's mentee, the first female health minister of India, founded in Sevagram, where Mahatma Gandhi actually started his Satyagraha movement. So it was a very inspirational place. And I realized that if I could prove that we could do really well in screening, and this is today is coincidentally today is World AIDS Day, and so my first study was in HIV, in detecting HIV in STD clinic attendees in this rural hospital in India, and using oral HIV test that became the self test. So the idea was to screen these STD clinic attendees, and we ended up screening and using this avant-garde test at that time, and introducing this new strategy that could actually facilitate and expedite screening services, because screening through traditional models took about 2 months 1 to 2 months, right? The lab-based screening services took time, and so we lost patients to follow up, and that is the traditional model. Lab-based services are great, but then they take a very long time. And so that study helped us pick up infections in non-traditional people. Say priests, for example, were found to be positive with HIV. Yeah, and so the value of that project really was demonstrated by picking up infection in people that most clinicians thought would never be infected with HIV. And so that study ended up also generating data for 100% accuracy, which CDC thought it was an outlier study. But because it was done in extreme circumstances in a rural hospital, using all the with all the in the resource constraint setting, it ended up being one of the studies that got a lot of press, got published in a good journal, and all of that happened. So that's when I realized that what, research is something that is actually working better for me than clinical care, because there's so many people doing clinical care. I'll be one of the many doing clinical care. Like, this is something that I actually have a talent for. And that led to another study where the women who were a part of my study told me, why aren't you screening just us? And it was like I was in the wards, going in through the hospital, meeting all these women, all these patients, and they said, why aren't you just screening us? Because we know that our husbands are sleeping around, and nobody really cares about us. And these were pregnant women. And it just gutted me so badly. I said, okay, my next study has to be, even before I finished this project, I had declared that my next study is going to be in pregnant women, and we have to screen them, and we have to set up a strategy. So we came up with a strategy of round the clock screening of women in labor, because most women were not being screened for HIV, and they were
This is in
showing up.
India, right?
This is in India. This is in rural India. And this 24/7 round the clock rapid testing strategy was very well received. It was published in PLOS-Med. It had an editorial, this and that. And incidentally, around the same time, I became a mother, which is when I realized what going through labor is, because I had helped women in labor as a doctor, but I hadn't really experienced labor. So anyway, so that being said, that study, at the end of that study, which got a lot of, again, a lot of press and publicity and attention, because it really, I'm not interested in all of the side effects of research. I'm more interested in touching people's lives. I wanted the women to be screened. I wanted us to prevent transmission of HIV in infants, which is what happened. I'm more interested in generating social impact. I wanted to set this up as a service to people. And so it led to a lot of changes within the hospital, where the healthcare workers also wanted to incorporate this strategy. And we thought about another one and another one to kind of just bring about change. And thanks to all of the projects, there was intensive screening of people who were non-susceptible was also instituted in that hospital. So that being said, we detected HIV in not just pregnant women, also prevented infection in their infants. And at the end of that study, when I was in Montreal then, the media came to me and they said, "Oh, this test is so simple. I want to use it as a self-test. I'm going to take it home." One of the media people like CBC and CTV and all of those. So I said, no, 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 you can't take it home and test, because I'll be in trouble with Health Canada. Please don't do that. And this is not yet approved. This has been given to me with a lot of, I don't do industry sponsored research. I do research. The industry is very nice and kind to me, but they donate stuff to me. But it's always, I have full independence to write whatever I want, which is what I negotiate. So then they said, but this, and that was the time I was brewing the idea of self-test. Little did I know that the industry was also brewing the idea, and FDA was also brewing the same idea. And that was the time I got into self-testing. So then as faculty, I designed the first study on self-testing and executed it in McGill students. And because I was doing McGill students, I said, you know what, I need to include something much more fun. It has to be avant-garde. So then I came up with digital solutions. And at that time, we had our first version of our digital program was very archaic, if I can reflect back on it. And when Grand Challenges happened, I wanted to take this, and I knew it sort of, the first few patients participants you recruit, how the study is going to go. It kind of predicts the trajectory of the project. So they were so happy. They wanted to enjoy it. They wanted self-testing. They said, we don't want to come here and waste our time. We really want to take this home. When is it going to be approved? That was way back in 2010. And it's 2023 now. It took Health Canada another 10 years to approve self-tests. Anyways, so then after the completion of that, I wanted to take it overseas, and I thought of South Africa. I thought of South Africa and India, but South Africa was one country that had the highest burden of HIV, right? And so I wanted to take this. And thankfully, Grand Challenges Canada had announced funding, and I said, this is my time to really, morph it into a bigger program. And so we met with challenges because at that time they said, "Oh, Dr. Pai, you don't need to introduce this. We already have HIV testing in a hospital. People do come." And the reality was, even though tests were available, nobody wanted to get tested because of the stigma associated with an HIV test. So we created this digital program where people could quietly test confidently in the comfort of their own home. And but we were not allowed to give them because the tests were not approved, because there are so many hurdles to clinical research, which is a whole another topic that I can talk another time. But what I did was, thankfully, my collaborator is also a very is an award-winning scientist in South Africa, and he's also, he thinks also you have to get the right people to support your project. So we offered this to healthcare workers because these were the easy susceptibles, right? The healthcare workers, instead of people in the townships. But our real calling was to really test this digital program out in the real township populations. For that we needed a lot of money, we had to do a field trial. So we tested it out in healthcare workers and they loved it. We had planned to recruit people in 6 months, 8 months, but we got them in 2 months. And I'm like, what the hell just happened? They enjoyed this discrete nature of the digital program. And that's when I converted it to an application, an app. And before even the first prototype was ready, I had declared it that I had an app, and so I'm a visionary person, so I could visualize it in my head that this is going to work. So I showcased it at a very powerful meeting in London, and I said, "This is how most Africans are going to self-test with HIV." And what's happening to my background here? I don't know.
It's okay.
Anyway,
Your meat kind of fades in and out. Yeah, it's fine.
anyway, so I kind of declared that at this very powerful London meeting where people said, "Nikki, you're crazy. It will be foolish to believe that people in Africa will be able to self-test using apps." And I said, "You know what? That's going to be the future." And this was in 2012, 2013. And inspired by that meeting, and inspired by the fact that I really wanted this out there, and I was possessed with that idea. I really wanted to do a clinical trial to prove that it works in populations that traditionally are not supposed to be self-testing themselves using digital products. And for that, we needed money. Thankfully, Grand Challenges Canada happened. They gave me money, and thankfully, around that time, I won this award. I had applied for an open access innovation award because I believe in open access. I believe in knowledge sharing. I believe in data sharing. That's how the whole transition to digital health happened for me. And so I applied for this award at the World, and this was an ASAP Innovation Award by the Wellcome Trust, PLOS Medicine, the PLOS Group, and Google. Okay. And so I said, okay. So my husband has this habit of teasing me. So he said, "Have you applied for that award?" I'm like, "Which award?" He said, "There's this award, and I think your program really, really kind of, qualifies for this award. You should apply for it." So I thought he was like, and I didn't take it seriously. But then one day I told my lab coordinator, I don't know why. And he said, "If you're not going to apply, I'm going to apply for mine." And I'm like, "What the hell do you have?" So, we have this healthy competition between us. So I said, no, 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 I'm going to apply. I applied, I put in my application. It was like a one pager. In fact, my biggest awards and programs have just been one pagers. So never ever so the moral of the story is never disregard opportunities that come your way, even though they are very subtle. And sometimes the biggest opportunities are like, just somebody, you have a casual conversation in the hallway and somebody just puts in an idea, and that is like the idea. So always be open and receptive. Anyway, so I applied for this award. Little did I know that I was selected amongst like top 10 in the world. And then they unleashed like news reporters on me, and they wanted to know whether my journey and all of that. And I sort of thought, okay, fine, now I should get really serious and talk about it. And we got the award. We were one of the top 3 finalists, and it was awarded at the World Bank, no less. And so, and in the spirit of my sharing, I shared that award with all my students who participated, and I shared my patent also with them, and I shared the award money. And some of them are in medical school. In fact, 2 of them have become doctors, and I'm so proud of them. And that helped pay their medical fees, all of the tuitions and everything. Anyway, so that cut the long story short. That helped me transition, and then we got the next grant. So in science, you have to demonstrate. If you don't demonstrate with evidence, in God we trust. All else bring data. So if you don't have data, nobody's going to believe you. And this is the story of my transition to digital health, and now into machine learning, and then I've developed like some 9 programs. So you go into this crazy mode of innovations, and now, yeah, that's where it happened. So Yeah, and so we're going to get to your questions. I think we're almost half.
No. I know. So I think, yeah, no, it's good to have the background. So maybe we just jump now to the work that you're doing in AI and transitioning. I mean, that's really your app and HIV testing. I mean, that's a whole other podcast, I think. But just narrowing down a bit more, just because we're getting to the last half here. So what is the research that you're doing right now that related to health and AI?
So my innovations are in apps, software systems, algorithms, generating algorithms to predict the risk scores for having a condition, especially with HIV and STIs, wearables, and predicting that, wearables for sexually transmitted and reproductive health conditions. And so we are currently leading a study which is funded by Grand Challenges Canada in India, where we are trying to look at documentation of menstrual health, because period health is one of those taboo topics that nobody wants to talk about. And that is the reason why I want to work in that space. The idea is to not only inform and educate people, in young adolescent women on their conditions, but also to help them track and also to predict the incidence of period disorders, which are actually on a rise now in the world.
What type of
Um,
disorder? Sorry,
sorry,
what type? PDO? You said?
no, it's period menstrual health.
Oh, sorry. Okay, got it.
Periods. So that's one. The other program is in mixed reality and virtual reality and augmented reality. And yeah, it's expansion of the program that I've already had. So we're talking about all of these developments in machine learning and in digital health and how they're going to impact the world. But what we're not talking about is training healthcare workers. So I've met with resistance when I introduced my app to healthcare workers and counselors like 7, 8 years ago, when they said, "Oh, Dr. Pai, this is not going to work. This is going to take away our jobs." And so I think that it's extremely important to train healthcare workers, also healthcare professionals and doctors, about all the fantastic solutions that are out there, and to destigmatize the process of absorption. Because if you don't do that, then the uptake is going to be really slow, and you're not going to be able to really, introduce the efficiency that you want with these solutions. So a bigger program with NIH funds, we are going to be training a lot of healthcare workers in 4 countries. And this is the 8 Smart program that I have that combines point of care diagnostics with many digital platforms and multiplex solutions, that is like testing for multiple infections at one time, right? So that you can save time for patients. So my basic gig is to really generate evidence. Like I said, in God we trust, all else bring data, and to use high quality implementation science methodological framework, including qualitative science framework, cost effectiveness framework, together with innovations, to really produce the evidence that the WHOs and the find and all of these agencies need to push these into mainstream. So that's where I think that's where my space is.
So
um,
just getting back to the app, just really quickly. So just curious on how the technology works. Is it like a diabetes test where you prick yourself, and it's a blood test that's like an app on a phone? Like, if you could just quickly give us how the
Right.
technology works
So
there.
this is a program that has a lot of data. So it's basically an entire solution that works on iPhones, on any other phone, like Google phone or Android phones.
Android, yeah.
Yeah, and it also works on tablets. It's available in 5 languages, including like English, French, Swahili, Xhosa. Yeah. And it's available through institutions if institutions are interested in using it, because we haven't really launched it in the open market because of the fact that it's HIV. I want it to be responsibly used. And the idea behind it is that you download it and you follow the instructions, and you also follow the instructions to not just get your counseling through it, but also you record your test result and you record the image of your test result. And we are working on an algorithm to improve the accuracy. And we found that there is improvement in accuracy when people use this program, increase in the accuracy of the test, because that's always under question. And it also allows you to chat with the counselors, and it also allows you to link to care. So we did a quasi randomized trial in South Africa about 5-6 years ago. We also published it in PLOS Global Health, BMJ Global Health. And we found that through this app, 99% of our participants got linked to care. And we
Oh,
have the
wow.
strongest data with app-based solutions in the world of HIV subtesting.
cool.
Yeah.
So just kind of trying to figure out how the sausage is made on your side. You mentioned algorithms, and maybe we could start with like, what does your teams look like? Is it a mix of, data scientists, medical professionals? Yeah, just a quick overview so we can get a
Yeah.
picture of what, the teams that pull these things together.
Yeah, yeah. In the past, I had a bigger team, but now I'm planning on a sabbatical. So I've reduced my team because I'm not allowed to have many people if I'm going to be on a sabbatical. But I've had engineers, I've had software developers, I've had behavioral scientists, I've had metrics, professionals who know how to report on patient-reported outcomes. I've had pure clinicians, ID clinicians, community health workers, depending on the project. Like for COVID, we are completing a randomized control trial in South Africa on COVID self-testing. I know it's very late in the game, but we still found a lot of good evidence on how it would work in South Africans, like a COVID program for self-testing. So I have a melange of people that I recruit, and they help me develop the programs. But I also increasingly, when I get more funds, I outsource the programs to companies now, because it's just become too much for us to do in-house development. In the past, we used to do a lot of in-house development. Yeah. So that's
Okay.
it. I work with a team of all kinds of people, because I love working with different brains. It just stimulates me.
Diversity, right? And so with OpenAI,
Hmm.
how is that concept and them opening up their technology around artificial intelligence help to accelerate or change the work that you do?
So it depends. The answer is it depends on what technology you're talking about and for what purpose it has been invented. And I see that when I talk about OpenAI to the industry, I receive pushback because industry is into monetization. But as far as the World Health Organizations and the public health agencies are concerned, they are increasingly interested in open access solutions that can optimize the efficiency of the healthcare systems in everything. So my solutions are basically tailored towards improving, like we have the access to linkage to retention gap. So getting, expanded access to care to get it to. So my work has always been in marginalized populations, so that, like improving the equity part of it, making sure that these solutions reach the people who are underserved. So access, and also linkage to care. Linkage is important because with diagnostics, it's extremely important to not just screen people, but also to pick up and screen and link both the positives and the negatives to care and counseling pathways. Because for HIV negatives, we have pre exposure prophylaxis available, medications that you can take to prevent yourself from getting HIV. And for positive people, we have highly effective antiretroviral medications that are available in all parts of the world. So,
Yeah.
so my programs are not just for HIV, but they're also for other sexually transmitted infections. So it's from access to linkage. And now I'm focusing more on retention in care, which is a problem because people do not take the medications as promised. So adherence is an issue. So that piece is important. And then also recording of your condition, like as you say in diabetes, you need to be proactive in monitoring your condition. And so it's important for HIV and STIs also, for certain HIV and STIs, that you need to monitor your condition and make sure that you go towards cure and control rather than get a repeat infection.
Yeah.
That's how
And
it works.
it seems though like a natural question for me now is like with your Apple Watch, for example, that monitors your heartbeat, your sleep,
Mhm.
your sleep behavior, things like that. Do you see in the future that your type of research would, be integrated into those types of models where, you're just from your watch be like, hey, you didn't sleep enough, you didn't eat enough veggies, whatever it is, you need more vitamin D. Do
Mhm.
you see a day where, the technology will get us there? And
Yes,
how, maybe
absolutely.
the question is, how far away are we from that?
Not very far away, actually. We are there. We just need to integrate everything. The problem here, and I think I'm going through your questions, the problem here is integration. I think that I think that is going to be a little bit of a challenge because of the fact that WHO has released its 6 principles for AI, that you have to protect human autonomy. You have to make sure that all the decisions have to be taken by humans, and humans have to be at the center of all of it all. So that is kind of I think that's really central to health in particular. I think we can skip the boat for industry, for banking, for driving your car. But that also human autonomy is important. But in healthcare, I think as physicians and as healthcare workers and as healthcare stakeholders, I think that is extremely important, because you cannot kind of give the medical, you cannot allow somebody else to make that medical decision making, that control on medical decision making or clinical decision making to somebody else. And I think that is going to be one of the stumbling blocks with many of these solutions. So you have to bring people in to be able to integrate them. Am I answering your question, or I'm digressing?
No, you are. I think I'm just a bit unclear when you say integrations, because when I hear integrations, what I think of is like data sets being integrated and being
Yeah.
able to share data across organizations in order to create better products. Or
Yeah.
is there a different type of integration
No, I'm
use
talking
case?
about integration of all these digital solutions within the fabric of the healthcare system, so that they are available to all populations, regardless of their skin color or the ability to pay, so as to optimize, like you cannot create, like somebody has said, I think it's Jeff Bezos, who says that, efficiency needs to be introduced into these systems. Otherwise, if digital systems are not created properly, all you get is a really fast caterpillar. So so basically, I'm worried about who is going to make those decisions. Are the right intelligent people sitting in these decision making bodies who understand? Because half the time, I think our job is to actually make people understand what we are doing with our lives. Why have we developed these solutions? And I'm talking about decision making bodies also in health. Like, why have we developed the solution? How is it going to impact? How is it going to get a patient from point A to point B? How is it going to help the clinician from point A to point B? How is it going to impact the the value of how is the value of care going to be optimized? How are you going to achieve the high value care that you care about? And is it really going to impact patient centered outcomes? I think part of our thing is just to educate the stakeholders who are making that decision. By the time they get to that point, then they have to employ the right person who's going to choose the best agile system that can morph. Because if you choose archaic systems, technology is developing at a very rapid pace. You're going to be stuck into like wanting to change the system, or wanting a system that has to incorporate all these different apps and solutions, and augmented reality and this and that. And I think that kind of forward thinking people, they are very few. At least the
Yeah,
ones that I've met are very few, and I just worry about how this is going to actually happen, in
yeah.
real life.
You mentioned. I just want to dig into this real quick. VR and augmented reality. Is the opportunity there for like remote surgery? Is that where VR you see the use case being?
Absolutely. And it's actually being done. Like at McGill, robotic surgery is being done. For cataracts, robotic surgery is an option. But for VR and augmented reality, I think it's an excellent tool for training healthcare workers.
Right.
And also to, like, I went through, eye surgery this year. And having been a surgeon in my past life, for once in my life, I had the humility to understand the patient perspective. Like it's very hard for us to be humble, I'm telling you, because we are always like wanting to be, we know healthcare, sort of, we wear that hat. But it's important to go through these life circumstance and life events to understand how a normal patient takes the procedures. And there's a lot of anxiety, even though I had all the facts and everything. There's a lot of anxiety associated with surgery. So what they have done in surgery and in OBGYN, they have created these programs that orient the patient to a procedure prior to surgery. They walk them through, and that has helped in reduced anxiety, increased ability to take that procedure, increased ability to handle, the consequences of a procedure, all of that. And for women too, if you're not used to what labor is, like I was used to the clinical aspects of labor and saving other women in labor, but I wasn't used to, my own experience of it was different. So it's important for people to walk them through to kind of prepare them. And that's where AR and VR are going to be extremely useful for surgery. And,
Right.
regardless of the robots doing surgery on you, but even with robots, there has to be someone who's going to, like go through the, yeah, go through like give the instructions to the robots to, the
Yeah.
robotic arm also has to be controlled by someone. So those
Yes.
are important. So, like I
Yeah.
said, there are lots of solutions out there. There are about 29, and I was looking at FDA's website in the morning today. There are 29 approved solutions by the FDA. Yeah, only 29 right now.
2029. That's a lot. Talking about FDA and solutions, just getting into the last few minutes here. going back to Canada and, saying like having people of talent like you and your husband come to this country to help drive innovation. What is your take right now, just in your space, on innovation in Canada? Because, part of what we're trying to do is to increase innovation, which builds jobs and job opportunities and strengthens the economy. In your space, how do you see the opportunities for innovation within this space in Canada? What is the state of affairs?
I think there are tremendous opportunities to developing, curating, and creating innovation and proving. Like I teach a course on design thinking at McGill in winter, and a lot of my students, they are from different. I make it very open, so I want people from different streams to join, and I create groups, and they come up with these innovative programs. There is a lot of potential for that. The thing where I think Canada really, I have to be politically correct here. I
Challenged?
can't speak my mind. They need to really be smart at is really taking up these innovations and commercializing them quickly. Uptake is slow. There are a lot of innovations in health that don't have a commercial model. They are really for public health and social impact. And I don't think many universities understand that really well. There are foundations out there that do it, but most people don't understand this whole not for profit ventures very well. So, although there are lots of innovations that are coming out of universities and of different incubators and this and that, I think their uptake is hindered by a very conservative Canadian culture.
Yeah, no,
And
that's a great point. I find that, and I think the access to finances too, right? The liquidity
that's all
of
part of that.
finance,
All part
right?
of that. All part of that.
Yes, yeah, exactly, right.
They
Um,
have to open up to really become. I'm not saying become like the Bay Area, but at least take cues from Boston and from Stanford and make, like, so triage those innovations. Some are pure commercialization, some are federal approvals, some are, just social impact. And there's a lot of benefit that universities can get out of that social impact, but they are not interested in it. And that's my gig. I really, I'm pained by that because, when you really want to talk about equity, then you know what is going to happen? We'll have lots of innovations. We'll have the wearables. We'll have it all for the upper income groups, for all the middle income groups. But then again, we're going to write about, oh, but this has led to an inequitable world. Yeah, all of the
yes,
academics are going to write about how we have expounded. I can easily see them coming in 3 years and 5 years. How we have expounded this whole gap, the divide, the digital divide, all of that. So to
yeah,
cut that crap, let's talk about models that are actually going to lead to. And there are a lot of social entrepreneurs out there. There are a lot of foundations, and they should be actively encouraged because there are lots of them, like say 40% of them, that most of our students, they've come up with such great ideas. I mean, I can't they're not protected, so I can't talk about them, but they are all for helping people who are not even getting access to basic health services, right?
yes,
And the younger generation today is has like the wildest ideas and the best ideas, and you need to harvest them. So you need agile thinkers who can tap into those people and their solutions and take them to scale. So we need those agencies in Canada. Perhaps your agency could be one of them.
that's what we're trying to do,
Okay,
Nitika.
great.
And we're at time, but I can talk to you all day, and I
No,
think
no, no,
people would
no,
want
no.
to listen to you all day. Just one last quick question, and this goes back to where one of the goals of this initiative. What are the job talent gaps in your area of work that you think young Canadian students, things like that, should explore? Like, what is it within, I know not becoming a doctor or data science, but what are the jobs you think that are lacking right now? Areas that are in high demand, you don't have
I
supply.
think I think data science.
Okay.
It's not difficult. It's something that people can do. Um, and if you have a quantitative bent of mind, there are lots of jobs in data science. Digital health experts, implementation science experts, they are going to be needed. Anybody who can do the crosstalk between federal agencies, public health, and industry, those kind of crosstalkers are needed. Innovation experts. I mean, if people can create a stream like that, who can
Yes.
really tap into that? And of course, EDI initiative experts,
Gotcha.
people who can actually level the playing field for the traditionally underserved populations. So
Yes.
those are some of those very good. And of course, industry has many jobs, so do not shy away from applying and get look. So my last 2 cents to the people here is like, don't shy away from getting, a job. Sometimes it may not be the job that matches up to your potential, but try and get in to the system. You never know how doors will open. Like,
Yeah.
it's these actors and directors, and you read stories of all these Bollywood actors and how they kind of did small parts and small parts and small parts, and then they got noticed. Yes, of course, it's a trajectory. But what I'm trying to say is, don't sit at home. Go out there. the
Yes.
the glass ceiling is only going to break when you're going to chip at it. So keep
Right.
chipping away at it until it becomes a hole, and then allow other people in. So my agenda in life is to help other people make passages for other people who can
Yes.
really level the playing field in Canada. That
It's
would be it.
possible. It's possible.
And people like yourselves.
Yes. Know your value, break your cultural conditioning, get out there, be bold, be shameless, be confident.